Welcome back to iLabMD. I'm Dr. Marie Azizian. Here we talk about functional medicine, the latest in functional medicine, the research and what's going on, and how it affects us, a regular average consumer, all these changes in the world and all this newest research. So today's topic is very interesting as it affects dementia, or more specifically Alzheimer's disease. So Alzheimer's is actually the most common type or form of dementia, because there are other types of dementia, of course. And this article, and I'll put a reference to it below, is from Frontiers in Nutrition. It's actually fresh off the press from earlier this year, January 2024. And it is called Consumption of Ultra-Processed Foods and Risk of Alzheimer's Disease, a Systematic Review. And this is an article by Paola Claudino. So it's interesting because in this article, what they try to do, they try to summarize variety of researches and tons of data into one study to come to a certain conclusion, or not come to a certain conclusion. But they took 5 studies where many people participated, and they analyzed those studies. So the number of people that they analyzed in these studies were actually 617,000 people. And there were 5 studies. 4 of those studies looked at correlation between ultra-processed food intake and between Alzheimer's disease. And one of the studies actually had the correlation between ultra-processed foods and cognitive decline. I think probably would have been better not to include the latter, although it helps. It helps because we are looking at cognitive decline, but for the purity, probably would have been better just to focus on these 4 studies, since they did have so many subjects for that study. So in this 617,000 people, there was half and half, male and female. Another slight weakness of this review, it's a systematic review, was that it was not the race or ethnic data was not included here, so we really don't know that. And one of these, the smallest study, had that most of the subjects were white, so would have been nice to have a little bit more diversity, but authors themselves did acknowledge that. So what is this study about? So they look at Alzheimer's disease, and Alzheimer's disease is, like I said, the most common form of dementia, and they have the statistics here that's really astonishing, that in 2016 there was 44 million people affected with Alzheimer's, and projected number by 2050 is 135 million. So basically from 44 million in 2016 to 135 millions projected by 2050. So that's very scary, of course. And so we look at what is the mechanism of Alzheimer's disease. The mechanism, at least right now, the accepted mechanism is that there is an overdeposition or too much of beta amyloid protein that accumulates outside of the neuronal cells. What causes Alzheimer's disease, and that's and how to prevent it and how to mitigate it? This is what all these studies and research are all about. So, and I also have to say that when we talk about research in Alzheimer's, and in general in many research articles that we look at functional medicine, they're not functional medicine articles per se. They are conventional medicine articles, but sometimes they are, in a way, they could be underappreciated by a general public, because often an article comes out and it doesn't offer a new medication or anything new. It just shows a fact that we need to take something away. Like in this situation, we're talking about the link between ultra-processed foods and between Alzheimer's. And there is a connection that each of these studies has shown. So first things first, so what do we call these ultra-processed foods? I think a lot of us intuitively know what it is, but just to define that, ultra-processed foods have a lot of total fat, saturated fat, a lot of simple sugars, and generally a lot of carbohydrates, sodium, low fiber, and a low vitamin density. And what they did, they had this 617,000 people. So the people that were recruited in this study, they did not have dementia, so they did not have Alzheimer's, and they were not also pre-demented, if you could say that. So, and these people were monitored, depending on the study, somewhere around from 8 to 24 years. And the ultimate outcome, the end outcome, was whether they developed or did not develop Alzheimer's disease. And how that was, of course, monitored by their medical diagnosis, but also was monitored by different surveys, and including also cognitive surveys. So that's why, as I mentioned earlier, one of the studies actually documented the cognitive decline. So they took these people and they also looked at what they ate, because that's sort of the most interesting part of the study. And just to be very specific on what these foods are, these ultra-processed foods, we defined them, but now we're going to specifically say what they are. They're processed meats, processed seasonings, there are hot dogs, salami, there are boxed cake mixes, there are cookies, ice creams, margarines, other butter substitutes, breakfast cereals, very important, pies, pre-prepared pasta dishes, pizzas, chicken and fish nuggets, sausages, hamburgers, other reconstituted meat products, instant noodles, powdered mixes for soups or desserts preparations. So, and the list goes on, actually, there are more. And so this, of course, is scary, because this essentially describes I would say 80% of the contents of any average supermarket. So to move on, so with this study, so they looked at consumption, and they compared these people with a control group which either did not consume this ultra-processed foods or consumed minimal of ultra-processed food, because it would have been very hard to have a group that completely did not consume ultra-processed foods. So, and then they basically had a conclusion as to what were the exact results. So just to go on here, that they did say that 4 of these studies showed increased higher risk of Alzheimer's disease, and one of the studies showed just increase in cognitive decline. But to go now, let's go into numbers. So, but let's be more specific in here. So, addition of just 10% of ultra-processed food was associated with 13% increase in Alzheimer's disease. So that 10%, so changes in your diet by 10% in a bad, sort of towards the bad side, that's actually very scary that it can have such an impact. And vice versa, they show that if you improved your diet by 10%, you're actually decreasing your risk of Alzheimer's by 17%. So that's amazing that there is so much control. And I know I say that a lot in these videos, that we do have control over many of our illnesses, many of our diseases, because we can control what we eat. So one of the very interesting thing that they put in, and which I hope translates well, is that eating just 25 grams of bad food, ultra-processed food, call it ultra-processed food a day, increases the risk of Alzheimer's disease. And what is 25 grams? Just for a reference point, a cookie is an average, let's say, store-bought cookie, not like a mini cookie, but average cookie is about somewhere between 40 to 60 grams. So 25 grams of a processed food is already causing damage and can lead to Alzheimer's disease. In addition, in some population who is more susceptible to Alzheimer's disease, and there are people with genetic predisposition, and they have genes that are called APOE genes, that type of population, in them that association is much higher, so they're even more predisposed to develop Alzheimer's disease. So how do we look at it in terms of the mechanism? How does it happen? And some of it we understand because thankfully there's so much literature now, both on in social media and in just regular magazines and online, and just people are just becoming more and more knowledgeable, so they understand how processed foods in general affect our hormonal system. They affect the insulin level, they cause insulin resistance, and etc. So how does it get now to the brain? So there are just a few points here. So one of them, of course, is high sugar and high fat. What happens with high sugar and high fat, it increases inflammation of the whole body, or as we call it, systemic inflammation. So that's one mechanism. So we have high sugar and high fat. Then we have the second second mechanism, which is a high sodium. What does high sodium do? The high salt. We all know that high sodium increases our blood pressure. And what does increased blood pressure mean for our brain? It means decreased cerebral flow. So decreased flow to our brain. So our brain is not getting enough oxygen. So our brain is being starved. Wouldn't you think that it would cause some damage in the brain if you do it consistently, day after day after day? You eat a Twinkie, one or more, and that's real. That's real, and that's happening. The other mechanism is increase in preservatives. As we know, all of these processed foods, and a lot of them are convenient, foods of convenience. They're sold at convenience stores, which sort of makes sense, but they're sold everywhere now. So ready-to-eat foods, so they have tons of preservatives. And what do? They decreased our capacity to fight stress. In fact, they add to oxidative stress, which is the stress that our body has to fight in terms of metabolizing toxins, because we are throwing toxins at our body with these preservatives. And finally, well, maybe not finally, but at least for the purpose of these this discussion, the other point is the packaging, because there are some bad components in the packaging, and one of the some of them are methyl mercury, and the other ones are polychlorinated biphenyls. So, but I want to say about the methyl mercury, which is important. The study was done that showed they directly affect tau proteins. Tau proteins actually are proteins that are in our brain, and they participate in formation and stabilization of microtubules, in the brain of the neuronal cells. However, those proteins, they could be susceptible to environmental changes, to genetic errors, and basically they're fragile. So if we have something like this packaged toxins that affects those tau proteins, that is a significant finding. So, and all of this together again increases inflammation, it decreases the oxygenation decreases the oxygen available for our brain, decreases the nutrients to the brain. So at the end, day after day after day, so here we have the changes that lead to Alzheimer's disease. So very, very interesting article. And additionally, they do mention how this ultra-processed food affects a functionality of this gene that's called SIRT, SIRT1 gene. And this gene also plays a role in metabolism regulation, in inflammation modulation, also has a correlation with insulin resistance, of course, and metabolic processing. So it does cause metabolic dysfunction if this gene is affected. So multiple ways, multiple mechanisms are noted, and I do think that, as I always say, it's much easier to add something than remove something. So it's very understandable that it's so hard to remove things. People like to add things. That's why a lot of people like taking medications, or at least not opposed to it much, because they can add and continue with their lifestyle. And when you ask somebody to remove something, remove an offending food, nobody likes that. But just removing, just decreasing some of these ultra-processed foods will make a difference. So I think that's a great message from this very interesting articles. And again, this is just a systematic review of the previous data, but it's a very good article. And I think that articles like that, they do bring more and more attention to our diet, to our nutrition, and that is the basically big point of a big component of our life, whether you are a follower of functional medicine or not. Thank you very much for listening. Until next time, bye-bye.